Welcome to Adapting Class. NCLEX review concept and questions that usually show up on your exams using some test-taking skills. You learn a lot of test-taking skills and a very good high-yield topic that shows up in your NCLEX that you need to know. Third question, battle up and let's go. First question, as usual, is going to be prioritization. And what do you have to be? You have to be sharp. What do we have? Client on Lisinopril and cough. Lisinopril, potassium of 5. Lisinopril, ECG positive, HCG positive, last menstrual period 4 weeks ago. Lisinopril and having problem closing the last bottom of the sheet. What do you think? If you see a prioritization question, you got to be sharp. Breathing problem, electrolyte, shock in sepsis, hypothermia, airway, and pain. Cough, is that more important than hyperkalemia? Is this more important than having a defected baby? Then not being able to close the last portion of your bottom, is that more important? Cough is a breathing problem. Hyperkalemia and teratogen, but it's 4 weeks old. This is fine. I have time to tell you to stop taking the medication. Potassium 5 is not that high. When you develop this, there's indication that you will lead to development of angioedema. But if you cannot tie the last bottom of your shirt, you have developed angioedema. This guy is an airway problem. It's pending problem. You'll get into trouble very shortly. Therefore, we should see this one. Hyperkalemia 5 is not that high, but we can treat it if we need to. And then cough is a warning sign that not able to tie your shirt, you already develop angioedema. I need to fix that problem. First question down. Next question. Who do you see first? Client 2 days old with a heart rate of what? 125. Client 2 days old with respiratory of what? 35. Client 3 days old, blood pressure 67/40. Client 5 days old, heart rate 165. What do you think? If you're less than 30 days old, okay, these are on unit, right? You know their heart rate, right? It's 110 to 160. Their respiratory rate is 30, sometimes 30 to 40, right? And then some people say 30 to 62. Some people, I've seen some people say that, but I stick to this lower number, 30 to 40. Blood pressure is usually 65 to 75, okay, about 40 to 50, right? This is good, this is good, this is good. Their heart rate can go to 180 if they're crying, but there's nothing here saying that this patient is crying. Therefore, I need to see this patient. You have to know these numbers. I know they give you numbers for what? The cases, but for this ones, you don't get any numbers. It's prioritization. You have to know those key numbers. Okay? Who do you see first? Like I told you, it's a warm-up, but to get you thinking. Client with Crohn's disease using what? Salt substitute. Think about it. Client with Crohn's disease, I try to pick the same thing so that you can think, you pay more attention to the most prioritized information of the diagnosis. Low salt diet. Think about it. Client Crohn's disease prescribed spironolactone. Same problem, Crohn's disease with the U wave on telly. What is Crohn's disease? You got to bring your theory, your content. It's aldosterone. It secretes aldosterone. And what does aldosterone does? Increase your blood pressure, hypertension. How does it do that? It increase your sodium and get rid of your potassium. Now that I know what is the problem, that means I need to have too much potassium and sodium and less potassium. So what do? I use salt substituent. Salt substituent has potassium chloride in it. It does not have sodium. So my potassium is low. If I'm taking this, that's good. I'm not increasing my sodium, I'm increasing my potassium. So there's no problem here. Crohn's disease, low salt diet. Yes, your sodium is too high. So lower your sodium so that your blood pressure can go down. Crohn's disease prescribes spironolactone. What block aldosterone is spironolactone. Spironolactone. So that's what will block it. So that's good. We're treating the aldosterone tumor. If you see U wave, now that we've eliminated this, you have to pick this because this is test-taking skills. You have eliminated 1, 2, 3 using your content. You should not guess yourself. When you see such scenario in your test, you eliminated 3 answer choices. The next one, whether you understand it or not, this is a test-taking skills. Pick it and move on. U wave, what does that mean? It's hypokalemia. That's one of the EKG you see. So this patient potassium is too low. Now there's EKG changes. We have emergency. So we got to see this patient. Now, those warm up is over. Let's look at another cases. How do you do this kind of question? Reading from the back. Which of the following should be included in the plan of care as potential source? So something that should be included as the source of the problem, right? A nurse is caring for a client who arrived on the ward after colectomy. He had surgery, abdominal surgery, key term, colectomy. Patient developed what? Fever, 101. When is that? Post-op day 1. So post-op day 1. That means day 1 after surgery, patient has what? I'm rewriting my questions and my keywords. These are my keywords. So I have fever. So what are the causes? Using my content to rewrite it. I can tell you, easy way to do this is 5 W's. Post-op fever, day 1, 5 W's. We call it the win. What is your win? Is it your lung? Athletics. Number 1, right? Water. That's your kidney and your bladder. So UTI, right? And walking. What is that? DVT. Wonder drugs. There's a medication causing the fever. And what do we have? Wound. So every time you see post-op fever, think about these 5 W's as the source of this problem. And they very notoriously, they are the main thing you have to be searching for. And when you search for them, they are the most likely source of infection for this patient. So what do you think? Lung athleticis, UTI, the wound infection, DVT, and what? Drugs as the problem. These are all source of fever post-op day 1. So the 5 W's for post-op day 1, you should learn them. Another question. Select or apply from the back. Which of the following the nurse should monitor to prevent major immediate post-op operative complication? I'm using the last question to rephrase it to give you some idea, make you thinking. Which one is the nurse should monitor? I need to monitor something, okay, underlying keywords, so that I can prevent major. You see the word major there? Okay, immediate, right away complication after surgery. A nurse is caring for a client who arrived on the ward after collecting. Which of these she need to monitor to prevent major complications? Select or apply. There's 4 answer choices there. You pick those that you are confident. For your test, anybody who have surgery, you should be worried about what? Bleeding. Okay, you should be worried about what? DVT. and you should be worried about infection. These are the 3 things you should be worried about that will prevent major complication. I know they will have pain, but the effect of pain is not that bad. It's not a major complication. If you don't manage their pain, it can affect them psychologically. But one of the immediate major complication right now we're talking about is I need to check for patient bleeding. I need to monitor them so that they don't get infection. And I need to check them so that they don't what? DVT, right? So you check their wound and make sure everything is okay. They're walking and getting out of bed to prevent DVT and lung infection and other thing. And then evidence of bleeding and shock. I know we have to give them some pain medication, but that is not the major immediate post-op complication. The 3 is what? Bleeding, infection, and DVT. So I call it PID. PID is your immediate post-op thing that you're supposed to do right after the patient comes in to prevent major complication. Twice a day, you got to check it. PID. Check for bleeding, check for infection, and check for DVT by letting them work. PID to prevent immediate complication. Number 6. And then should document what? A client just delivered a baby boy that was rushed to the NICU. Okay, what is the problem? Examination reveal what? There's a tufts of air. There's a nevi and a dimple at the lumbar sacral area. So if this is the kid, and this is the sacral area, there's the tufts of air. There's a nevi, like mole, and then there's dimple right here. Tufts of air, nevi, dimple. There is no exposure of the meninges. There's no exposure of the spinal cord. Everything is covered, but you see these stretches over there. No bulging, nothing like that. So that is Spina Bifida. Meningocele, there will be a bulge, okay? But you just look at the name, meninge. You just involve the meninges are the nerve root and the nerve the surrounding of the spinal cord, basically. So that's that one. You see myelomeninges. This one involves the spinal cord and the nerve root together with the meninges. So there's 2. If you forget, think divide it. Meningocele. So this is 2. You have the spinal cord and the meninges together with the nerve roots. And it's covered. This is covered. You have the spinal cord and the meninges. This one, we have just the meninges covered. Myelochesis means we have spinal cord plus meninges plus is uncovered. This is the dangerous one. Is uncovered. So that's that one. So myelochesis are spinal cord, meninges exposed, but they are uncovered. And those are the 3. But this answer choice is Spina Bifida. They only have tufts of hair, nevi, and dimple, but there's no meninges, there's no bulging, everything is flat over there. You have to know the difference between them. Number 7. A client was involved in a motor vehicle accident and intubated for GCS of 3 on Propofol. Keyword, Propofol. Keyword, Propofol. Which of the following the nurse should anticipate as side effect of this medication? Select or apply. Propofol is a white chalky medication. We use it for sedation. It's mostly fatty in nature. If you use it more than 3-4 days, then you have large amount of fatty acid that is being blocked and your body is not going to take it. What does it lead to? Ischemia to the muscle. The muscle cannot take it block the ATP pathway out to the body to take energy. And so if this is the muscle, muscles start dying, or everything starts with muscle death. And this can increase their CK, and it can lead to what? Rhabdomyolysis. And you release all your content of the cell, and that can lead to lactic acidosis. Okay, the too much of fat will lead to dyslipidemia. This muscle that is dying will release CK that go to the kidney and cause kidney failure. Okay, because the heart is a muscle, it's also dying. And the liver will be overwhelmed. You get liver toxicity. You should expect potassium to be high, and you can get cardiac arrhythmia. So these are all side effects that's expected with the use of Propofol for longer days. Acute renal failure, dyslipidemia, heart failure, liver toxicity, metabolic acidosis, and rhabdomyolysis. But you don't have to memorize. Just go through the pathophysiology and say, excessive fatty acid, the body cannot take anything. We go into lactic acidosis, muscle is dying. The rest is history. Every organ that is a muscle is going to get in trouble. Select and apply. And next assessment, the next assessment should indicate an ulcer for what? A client with what? Claudication. Yes, claudication. Present to the vascular clinic with an ulcer. So I have claudication. This is my leg. That means if I have claudication, that means if this is the artery, there is atherosclerosis all over. Therefore, I have what? Peripheral artery disease. I intentionally did not give it to you. If you have claudication, you have developed peripheral artery disease. And therefore, what do you think? This is content. In a peripheral artery disease, the ulcer, they will develop, the blood flow is decreased. And it decreased. The problem is the one that gets into trouble is the distal aspect. So it's the distal aspect. So the ulcer, we say where the ulcer is located at the medial aspect of the ankle. This is wrong. This is usually for venous disease. For peripheral vascular disease, peripheral arterial disease is usually lateral. Ulcer is located at the lateral and just below the ankle. Yes, this is the ankle, right? Venous ulceration will be here in the medial aspect and above the ankle. Peripheral arterial disease will be below, right? It's on the lateral aspect of it. So this is the difference. This is venous, this is arterial, and then this is below the ankle. That's key. So this is right. Punch out look round and well defined. The ulcers look like it's coming out, and it's punched out. It's look like it's coming out. So that is the way it's supposed to look. Located at the tip of the toe. Yeah, you can get it at the toe here too. Located at the heels, yeah, where there's pressure. Also, you can get it at your heel. So heel, below the ankle, and at the toe. Located at the heel, right there. Beefy red, no, it's not getting blood. So the base of the ulcer look pale. Okay, it's not beefy red. So this is the venous problem. Yellow, dry base, excellent, and it's deep and painful, right? Yellow, dry, deep, right? It's like that. So yellow, everything is deep and it's painful because of the decreased blood flow. And the black sore and no bleeding. Yeah, sometimes you look ischemic, okay? And then there's no blood. I mean, it doesn't bleed that much. Yeah, that is the ulceration. So this is the content, okay? Content for peripheral artery disease. And this is the way their ulcers look like. The location is below the ankle, at the heel, at the toe. It's punched out. It has very round where you find edges. The base is deep and painful and dry because of lack of blood flow. So you got to know this. You should take a look at it, spend some time on these ulceration characteristics of the artery. I have a venous one on the questions, but I didn't put it right away. I want you to think later and we'll come back to it. Normal 9. Which statement below is a priority? Select or apply. A client 5 weeks postpartum was seen in the OBGYN. 5 weeks, very important time. As a follow-up, okay? She reports sadness, 1, irritability, okay, emotional outburst, mood swing since discharge. Which statement below is a priority? So it's been 5 weeks, and we have sadness, irritability, emotion, right? Outburst, and then mood swing since we've been discharged at home. Right. What do you think is the problem? Which of the following is a priority? I'm going to ask about sleeping, weight loss, problem with taking care of the baby, the thought of self-harm or harm to the baby, and the feeling of hopelessness. What do you think? Which one is more dangerous? And you have to take care of the 5 weeks. Asking about sleeping does not help you because we have 3 types of things that happen. We have the blue, we have the depression, and we have the psychosis. The blue only occurs 2 weeks. And he has some of these features: sadness, irritability, emotional outburst, right? Depression occurs 4 to 6 weeks. He also has the same thing: emotional outburst, sadness, mood swing, right? Psychosis, they have hallucination. They occur after 2 weeks. And they have hallucination, they have delirium, and all the signs of psychosis. We don't see any sign of psychosis, so that one is gone. We already know they will have sleeping problem with depression in blue. So if you ask for sleeping problem, it cannot give you any information. Since it's been 5 weeks, we worry about depression. So evaluate the patient on depression. So 5 weeks, between 4 to 6 weeks. Since it's been 5 weeks, then I'm more concerned about depression. So which one is more dangerous on depression? No problem with sleeping, no weight loss, no problem taking care of the baby. Yeah, any thought of self-harm to the baby, and whether you feel hopeless. These 4 and 5 who diagnose depression in the mother, and you're taking risks of suicide. So those are or homicidal. 4 and 5 are most priority. Which assignment is appropriate? And next, from the inpatient psych, it came from the inpatient psych, was transferred to the maternity ward, and due to nurse shortage. So there's a nurse shortage. Somebody from the inpatient came to the maternity ward, and there's 4 patients. The key word is give them that something they're comfortable with, or something within their specialty. Don't give them anything that is specialized to the new ward. Or you can give them somebody who is stable, that has a routine nursing care. Okay, those are the strategies. So postpartum client, they are postpartum. You already had a baby. You got C-section for abruption. Yeah, I don't think so. This lady will need a lot of staff. She has just had an abruption. Yeah, it need a lot of staff. A psych nurse should not be taking care of it. Postpartum, C-section, we need a lot of staff. We got to monitor hair still. Patient, postpartum client, C-section for prior C-section ×3. This may be a potential. She was scheduled for C-section because she had 3 C-section before. There's nothing crazy about it, right? Look at 4. Postpartum client scheduled for C-section that she already had. Now with what? Sadness, irritability, 2 days after delivery. We already talked about it. It's just 2 days. It's within 2 weeks. So this is what? Blue. Postpartum blue. Who do you think is the best person? It's the psych lady. The psych nurse should be able to take care of it. Even though 3 is okay, the most appropriate is this. This lady is having some psych issue. She will be the best person to, because that lady, the number 4 clients who need routine care, but also has a psych problem. Oh, that's the best person she can take care of. This is a made-up question, but just to help you about floatiness. Demonstration of that. 12. What is the next best action? Always best action. A competent client is a competent. Keyword. Pay attention. If they say he's not competent here, you have to change your mind. Competent client is the reason why he's there. Present to the emergency room with chest pain. He has a back problem that radiates to the left shoulder and nausea. Troponin was elevated and EKG shows anterior MI. So patient refused admission and treatment. What is the next best action? Break it down. We have what? What is your next action? The key word is a competent patient who has a heart attack and is refusing admission and treatment. What do you do? What do you do? Is competent, right? Allow client to leave. No. You can allow him or her to leave, but they have to do something. Call the MD. It's okay. It's not going to fix the problem. We already know the patient is not coming to convince the patient to stay, right? Patient already is competent. Call nursing supervisor. What is she going to do? Let client sign AMA forms. He want to leave, he's competent, he's allowed to make his own decision. He knows life and death about this problem. Let him sign the document. If you want to leave, that's fine. But you have to inform him about the risks and benefits. So this is the best one. You have to call the doctor though. Let the doctor know that the patient is going. But what you can do is give him the form and then he sign it. And that's the best answer choice. Whenever a patient said, I'm leaving, yeah. Sometimes because when you try to call the doctor, they will say they will leave anyway, and you will not have the chance for them to sign the AMA form. So get them to sign it, and the doctor will come and explain it to them. Say, okay, this is the risks and benefits, you sign it. So what teaching is appropriate? Select and apply. Same thing, right? Start from the back. Know the key content and put it together. A client with long-standing what? Psoriasis with recurrent flares up. Ask the nurse on how to avoid trigger. Those are the keywords. I have psoriasis, and I want to prevent recurrent. What do I do? Teaching. In your test, when you see alcohol, when you see smoking, when you see caffeine, these are never good. They are irritant. So any problem that they said avoid something like that, I'm picking that answer. So alcohol causes inflammation. It makes the psoriasis very bad. Gluten-free diet has been noted to cause a problem. So no gluten basically in psoriasis patients. So they should start gluten-free diet. It's one of the celiac disease, but not only them. Celiac disease patient and psoriasis should avoid gluten in their diet. Red meat, yeah, avoid it because it's inflammation. Yoga exercise, this is stress. Avoid stress. Whenever you see yoga, you're talking about stress. Sun exposure, no brainer. It's a skin problem. If you expose yourself to sun, it's going to burn you. You're going to get worse. Avoid cuts and bruises. It's a skin problem. Even if you don't know, if I cut the skin, yeah, healing problem, inflammation, psoriasis will get better. And of course, smoking is always bad. So all of them are things you need to tell the patient to avoid to prevent triggers. This is designed to, it's a content at the same time teaching so that I can show you strategy. But these are some questions that you needed the content, so I'll give you all to you. Select or apply, right? A client with cerebral palsy, keyword, right, was prescribed Baclofen. What is that? Which of the following the nurse should anticipate as intended effect of this medication? Look at the language. Anticipate intended effect of this. All it means is therapeutic. So what is this? Therapeutic. You see how I rewrite it? Baclofen, and I have therapeutic effect of Baclofen. What do you think is it? Baclofen. It's a muscle relaxant, very strong one. And we usually use it in people with cerebral palsy. So it relaxes your muscle, improve their movement, and it makes their muscle less spastic. But it's also used for pain. It helps with their pain with cerebral palsy. No urine retention. Reflex doesn't go up. It just relaxes the muscle. So it reduces decreased spasticity and also relaxes the muscle. This is saying the same thing. And it decreases their pain. So 4, 3, 4, 5. That's the function of this medication. It's a muscle relaxant. So if you see question like that, think muscle relaxant. It's different. It's the same as Flexerol and other thing. They do the same thing, but they act different pathway. So it will decrease your spasticity, relax the muscle, and decrease pain. Another question, 15. Select or apply. Which statement below require immediate intervention by the nurse? So, SATA statement, immediate intervention. A client with bipolar need teaching on what? Lithium. Then you rewrite. Lithium, teaching. Intervene. That's all. Right? What is the problem with lithium? You want to avoid dehydration. Anything that affects your kidney, you have to worry about it. And your GI tract. If you're having too much diarrhea, it's a problem. You're vomiting, you have a problem. And you have to make sure your sodium is normal, right? I will go on low sodium diet, negative. Low sodium will make this lithium very toxic. So that's need intervention. I will call with excessive diarrhea. Yes, that will prevent dehydration. I will avoid NSAID. That will prevent affecting the kidney. I will ask my PCP to take me off my diuretic. That will prevent dehydration. I will start using salt substituent. Salt substituent means what? They're taking potassium instead of sodium. So thus we need to intervene. Salt substitute does not have what? Sodium in it. It's the same thing as what? Low sodium diet. Your test sometimes can do that to you. They give you two things that sound the same. Yeah, they're all wrong. Salt substitute, that means the patient is on low sodium diet. We don't want it to be on low sodium diet. So that answer choice is also something we need to intervene. This is a classic board question. You expect something like that when they ask you, that's how they would trap you. But you have to bring your content to analyze it. So 1 and 5, your right answer. We need to require immediate intervention by the nurse. Select or apply. Same thing, right? What transmission precaution the nurse should educate the new graduate about? A client with HIV, carrying as a HIV, was admitted for failure to thrive, so he can't take care of himself. The nurse is educating new graduate about how to care for this patient. What transmission protocol? You have to know this because they're going to trap you. Everybody think HIV is like something contact. When people walk around with HIV all the time, you don't know. You touch them, you don't know. Yes, HIV is not contact. It's not airborne. It's not droplet. Just standard. It's a standard precaution like you do with any other thing. So no, HIV is a standard precaution. You should teach them to institute standard precaution. You don't need mask, gown, unless you're doing something. Yeah, you got to have your normal PPE. But you don't go and wear N95 talking to HIV patient. You'll be looking at you like, I'm not infectious. Okay? You got to protect yourself though. Which of the following is consistent with the diagnosis? Select or apply, right? A 25-year-old female, keyword. This looked like a case study, but I shortened it. Present to the primary care with the complaint of what? Buzzwords. Abdominal bloating. This is a brief case study. Cramping, okay. Foul smelling, stool after taking what? Oatmeal and wheat. A favorite food. This way is favorite food. A client BMI is 19. She's not growing. Which of the following is consistent with the problem? So think about it. We have a 25-year-old. BMI is 19. She's not anorexic. She tried to eat. Every time she eats, she has what? Bloating, cramping, foul smelling, fat. When you see foul smelling stool, that means fat soluble problem. After taking what? Oatmeal and wheat. What do you think is going on? Every time she eats oatmeal and wheat, she has to have this problem. This is celiac disease. In the celiac disease, you should avoid what? Raw. So, and its inability to process gluten. You should avoid raw. Barley, rye, oats, and wheat. She should avoid it. But she's okay to use what? Rice, corn, and potatoes for life. And she should avoid this for life. Because of the recurrent infection, the intestine villi is all destroyed. If this is the intestine, the villi look like that. The normal villi is like that. They very tall for absorption. But this one, they've lost it. Therefore, that the recurrent diarrhea, you will have fat soluble deficiency, which is what? A, D, E, K. Vitamin A, vitamin D, vitamin E, and K. So the patient will have replacement, right? Read food labels when shopping. You have to be avidly be reading, looking for gluten, okay? Making sure you don't eat barley, rye, oat, and wheat in diet. So this is celiac disease. Very interesting short case where it includes everything that you need to do about teaching. If they ask you what kind of complication you get from celiac, it's lymphoma. So they will get lymphoma from this problem. You got to watch them for lymphoma. That is shorting. Which of the following should be included in the plan of care? A 5-year-old client, right? 5-year-old client, young boy, present to the ED who is crying, drawing the knee to the abdomen, and non-consolable during this episode. He had bilious emesis in the emergency room. Examination revealed palpable mass in the mid-abdomen and mucoid blood-thin stool. Which of these should be included? Did you diagnose it? 5-year-old. He has what? Drawing knee to chest, right? And he's crying. You can't console him. He has a mass in his abdomen. And he has this mucoid blood thing and stool. What do you think? This is current jelly stool. Okay, this current jelly stool. Based on this, drawing the knee to the chest, this is what? Intussusception. It's a GI problem, acute GI problem. What is the thing you need? MPO, IV fluid, at least. To make a diagnosis, CT does not help you in this situation. You need either air enema or contrast enema. And that will help you make a diagnosis. But the best enema is this air or pneumonic. You can do this. This is therapeutic and this is diagnostic. That means you can find the problem and treat it. Contrast is just diagnostic. So usually we prefer number 4. But this is a SATA question. So I don't think CT is indicated. You never get CT for this problem. Most of the time, contrast enema to make the diagnosis, or air enema, make a diagnosis and fix it. So that's the way this will be set. Selected apply. A nurse is caring for a client with salmonella infection. Which prescription the nurse should anticipate for this patient? So think about it. Salmonella is a bad infection. The best indicators are cephalosporin, third generation. This is the best medication that we can use to treat it. Of course, the macrolates can take care of it, and fluoroquinolone can take care of it. But vancomycin is no use for that. So 1, 2, and 3 are your right answer. Which transmission precaution the nurse should institute? A nurse is caring for a 5-year-old client with strep pharyngitis. It's a strep problem, and it's a lung problem. What do you think? Strep staph, all those people are not contact, right? Are not standard, are not airborne. They are droplet and precaution that you need to institute for these people for the pharyngitis. Which of the following the nurse should include in the plan of care to avoid increase in ICP? A nurse is caring for a client with severe head injury with ICP monitor in place who is intubated. Breaking down. You have a patient who is severely injured. He has an ICP monitor in place and is intubated. What should you put in the plan of care? The main idea, like I talked on Saturday, if this is the brain and ICP is going to be high, we have to avoid secondary brain injury. So number 1 is oxygen to make sure there's no ischemia, and blood pressure, make sure it's enough to allow blood flow in the brain. Then you do other things that will prevent increase in ICP. Provide a quiet environment. Excellent. Don't suction them every 2 hours. You suction them PRN as needed. So that's wrong. Head should be in the midline, okay, and neutral, and it should be elevated 30 to 40 degrees so that you can drain the cerebrospinal fluid. Avoid constipation because you don't want them to do what? Strain. So that's something you make provision for that. You don't want them to cough and vomit, so antiemetic, and you give them oxygen, like I said. So all except number 2, you suction them PRN. Same story, the backup. Select or apply. And this is caring for a client with severe head injury who had high surgery now. Which of the following teachings are appropriate to prevent increase in ICP or intraocular pressure? The same thing. Sneezing is no good. It's Valsalva. You strain, you Valsalva. You cough, you Valsalva. You vomit, you Valsalva. Constipation, straining. You should not bend at your waist. You should not lift anything more than 20 pounds. And you got to wear your eye patch at night for the repair of the retina. But this is content. This is everything you can do to prevent ICP increase in these patients. Okay, infectious disease. This is me trying to confuse you. Selected apply. A nurse is caring for a client with mycoplasma pneumonia. Which transmission precaution and PPE for the routine care of the client is appropriate? You got to break it down. Infectious control questions, they are not that hard. You have to break it. If you break it down, you say that, oh, this is easy. I have mycoplasma pneumonia. What do you think? This is droplet, right? It's not airway. It's not contact airborne, right? If it's droplets, I don't need N95, so I'm not looking at that. It's not contact. It's droplet, but I'm not wearing N95. Neither do I wear a gown or gloves for routine care of the patient. It's not airborne. It's Droplet. I wear surgical masks. Droplet, I wear gown and gloves when I'm doing something that involves wound. So if I'm not doing it, so the only thing you can choose is number 5. Contact is not contact. So just know that when you're doing something related to if they ask you what kind of precaution, you're talking about the genuine one. There's no like, oh, I'm washing the patient, I'm doing this. No, it's just one side. Select or apply. Which of the following should be included in the plan of care? A nurse is caring for a client with cervical cancer who is receiving brachytherapy. So brachytherapy is a small implant or injection that provide radiation directly to the problem. So maybe sometimes they put in the cervix to do the uterine, basically if you have cervical cancer, to take care of the problem. Because of that, if we do it in the hospital, usually like 5 days, right? You need an appropriate shield for the client. No, the shield to prevent radiation goes to the client is already radiated. They have the thing in the abdomen or in the cervix. So the shield is for the nurse to protect themselves from radiation. Dosimeter badge for the nurse, to tell them how much exposure has happened. Careful with repositioning of the client. It's in the cervix. So when you reposition, it can dislodge. Then we have radioactive activity. Being exposed to everybody. So body fluid is radioactive. No, this is a trap. Body fluid is not radioactive. Lead handling at bedside. You need to have something if the lead fall that you call radiation control to come and pick it up. If nobody's around, you have to use the lead thing, but make sure you protect yourself. Limit time of exposure. That's why you have a dosimeter to calculate how much you've been exposed. And bedside commode, so that you don't have to get out of bed and go outside and then have a bowel movement. Whatever they want to ease themselves is right there. So you want to be so that they can stay in bed. So the key thing, as you can see, is 4, 2, 3, 4, 6, and 7. 2, 3, 2, 3, sorry, 2, 3, 5, 6, and 7. 2, 3, 5, 6, and 7. 25, select or apply. What is the anticipated priority action in the emergency phase? The nurse is caring for a client with 80% total body surface area who arrives to the burn unit. What do you think is the action at the emergency phase? Emergency phase is mostly resuscitation. It's different from reconstruction. We don't worry about skin graft right now. It's not a problem. We'll take care of it. But we need to provide nutrition, right now. Airway management, number 1, and fluid resuscitation. Wound care, we'll deal with it later. But this one, are number 1. Priority in emergency phase, not in the acute phase. Okay? And so that you can remember them. Topics. What are the next priority actions? Select or apply. So you have a client, a nurse is caring for a client with HIV and a CD4 count of 150. What are the next priority actions? So CD4 count less than 200, the patient is immunocompromised. So I have immunocompromised patient. I have to promote regular oral care. They will develop candidiasis. Promote skin care. Usually skin is a lot of ulceration and a lot of disease process on the skin. You got to be careful. Prevent infection. They are immunocompromised. Good. And provide nutritional support. HIV, they have a lot of diarrhea and they will lose weight. They will lose a lot of weight. So you got to provide this nutritional support as much as possible. So all of them are right answer. Okay, next one. What is the next best action? You got to do something. Don't call the doctor. Client with, I'm joking. A client with leg fracture at a cast place for stabilization. Client has been requiring pain medication every hour. That's your clue. If you're giving them every 1 hour, you're giving them pain medication, even though they are not in pain, yeah, this is the problem. I'm worried that this patient has developed something that you have to worry about. And the CSPs. So you got to fix sure they have additional CSPs with the leg findings, right? They're getting pain medication every hour. So that means something is not right. Call the doctor to increase medication. No, this is, you got to investigate. Elevate the leg, we don't do that much. Bivalve the cast, that means cut the cast off. Yeah, you don't have the right, it will not be best for you. Assess for compartment syndrome. Yeah, this is early signs of compartment. Pain unrelieved with medication. Yeah, I need to assess for compartment syndrome. 28. SATA. What teaching is appropriate? A client with GERD asks the nurse on how to avoid triggers. So what do you want to do? I have gastroesophageal reflux. How do I prevent triggers for this problem? Minimize alcohol and stop smoking. Why does this say stop? Test taking skills, smoking. But this one said minimize. So I like this. I don't like this. So minimize is the problem. You're not supposed to minimize. You should avoid it completely. Wait 2 to 3 hours after meal before going to bed. So that's good. Weight loss and use, so weight loss is good. And use chew gum daily. Yeah, wrong. Chew gum, you should not use chew gum daily. That will prevent, will cause more problem. So weight loss is good, but this portion is wrong. Therefore, you don't get anything. Avoid dairy product and fatty food. You should avoid fatty food because fatty food is take a long time to digest and it stay in your stomach and it make you distended. It worsen your symptoms. But dairy product does not do any harm to gastroesophageal reflux patient. The dairy product basically, if you have deficiency with that, it's lactose intolerance. It's just a trap. So this one. So it makes this answer choice still wrong. Avoid caffeine, peppermint, chocolate, carbonated drinks. Yes, you should avoid all these things will make you bloated. Head of the bed is about 6 to 12 inches using pillows. That's excellent. So we have 5, 6, and that's all. Because of the combination, some of them are partially right, some of them are partially wrong. Okay, what do we have? Select and apply. The nurse with varicose vein develop, a client with varicose veins develop venous ulcers. The nurse assessment should indicate an ulcer. Where would the ulcer be? It's due to stasis, so that's good. It should be shallow. Okay, it's beefy red at the base. Yeah, it has uneven borders. Yes, the surrounding skin is tight, it's warm, and brown is pigmented. Yes. Fibrinousness hesitate because it's weepy. There's blood flow there. It's weepy. So this is good. There's black sore and no bleeding. Yes, you should see that. There may be no bleeding and he has black sore. So this is content I've provided compared to the initial one we did for peripheral artery disease and see what is your issue. But these are the key facts you should expect in your exams. It's like you have to know the difference between venous ulcer and peripheral artery disease ulcer. Which of the following diet is paired with appropriate conditions? So if you have medical problem, there's certain diet you're supposed to get, right? After stroke, yeah, mechanical salt is not a bad idea, right? It's not a bad idea at all. Mechanical salt is not a bad idea. Burn people need some energy to heal, so high protein is good. Emma, you have a heart attack, mostly you need a low-fat diet to prevent your atherosclerosis. Renal failure, you need a low-protein diet. because of the BUN, and the creatinine level can goes up. Liver failure, no protein at all. And if you prep for diagnostic study, what you use? Clear liquid diet. So that's what we usually use. In a diagnostic test, the patient will be on clear liquid diet while waiting for the test. So that's good. And the last one. Save it for the last. The client is preparing for in-depth colonoscopy and need instruction about diet, right? What is the next best action? You start high fiber diet 5 days before the procedure. You start low fiber diet 5 days before the procedure. At least you know one of these has to be right answer. Test taking strategy. Non-colored liquid day of bowel prep. Low residue diet 1 day before the procedure. So this is gone. No residue diet, high fiber diet, low fiber diet 5 days before. So that's fine. Then they can transition to clear liquid diet in 2 days before the procedure. The day that they're doing the prep, they can still drink liquid with only, they can still, that is non-colic, no red or something like that, but they still can drink liquid. So it's usually 2, 3, and 4 are your right answer. Once again, thank you for sticking around. This is a very comprehensive review. We tackle everything, pharmacology and GI, everything that you need to know. Very extensive, high-yield topics that shows up. It's a pleasure to be around. Thank you for watching. If you haven't subscribe for more content. Thank you and have a good day. Keep charging as usual.